Officials in 2 Latin American countries alerted the WHO of several outbreaks of a new infectious disease that's mysteriously appearing across the region: severe epidemic enterovirus respiratory syndrome 2025. Over the past 6 weeks alone, there have been 500 confirmed or suspected cases reported. The virus could cause a severe pandemic if early containment and mitigation efforts are not successful.
The pandemic in this type of situation and trend would be a risk for the global health security.
Pandemics are inherently political, financial, and so much broader.
We have not spoken on the leadership in country. And I think that we need to be also very careful. We cannot decide a lot of things without the leaders be involved and agree on that.
There is no substitute for national leadership.
It's important to support the local response or the national response.
Training those that are in these areas first, enabling them with the tools, protecting them, and if needs be, regional solidarity first.
At this stage, communication is key, and communication should include not just scientists with data, but also social, religious, and political leaders.
Trust. This is an essential issue, and trust was broken among countries, between populations and healthcare systems, between healthcare systems and governments.
I'm very sorry to say that in 2025, we need to strengthen the health system.
WHO needs to be a voice for the voiceless.
No one is safe until all of us are safe.
As of today, there have been an estimated 1 billion cases worldwide, with more than 20 million deaths, including nearly 15 million children. Countless millions are alive, but left with paralysis or brain damage. The most successful countries are those which invested in preparedness and trained for this moment years in advance. This included having full-time pandemic preparedness and response teams, which conducted detailed operational planning and routinely tested those plans through exercises and drills. If more countries had participated and heeded the guidance, the toll might have been much less.
I'd like to call to order this secret conclave of America's media empires. We're here to come up with the next phony baloney crisis to put Americans back where they belong, in dark rooms glued to their televisions, too terrified to skip the commercials.
Well, I think...
NBC, you are here to listen and not speak. I think we should go with a good old-fashioned public health scare.
A new disease. No one's immune. It's like the summer of the shark, except instead of a shark, it's an epidemic. And instead of summer, it's all the time.
That is smoking.
Now, I hate to be the guy who derails what everybody else loves.
He loves being that guy.
But, Janice, we do have standards. This can't be a made-up disease. The only moral thing to do is release a deadly virus into the general public.
We do have something we've been holding on to, but it hasn't been tested. Get over here, NBC.
Well, we certainly believe in testing, but Wow.
Oh, yeah.
So, we've got our deadly disease. Now, we just have to blame it on something that's in every household, something that people are a little bit afraid of already. House cat flu is coming, people. The Center for Disease Disinformation predicts with some degree of probability that the house cat flu might spread in the following hypothetical outbreak pattern. So petter beware, that warm body on your lap just might be ready to destroy your tender fiddles. Springfielders are advised to stay tuned for more information if they experience any of the following symptoms: mild thirst, occasional hunger, tiredness at night.